I'm Barbara. This is Kurt. We're going to show you how to do some wound cleansing and dressing. The first one will be an abrasion. The second one will be a puncture. The third one will be a laceration, and the fourth and last will be a scalp wound. I'm going to show you what I have for first aid supplies in a very light pack. I have goggles, a mask, and gloves in a bag, hand sanitizer, 3x3 gauze, which is a good size, some betadine, a syringe, a large Band-Aid, Neosporin, 2 rolls of ACE wrap, 2 triangular bandages. The blue roll is a Coban. I have a seated cushion and a Splint. Accessory items include a yellow balaclava. And then for water, I have my Camelback, a pink Nalgene, and a squirt bottle. Kurt is our victim. He has been biking. He fell, and he has an abrasion on his left knee. I'm going to show you what to do to take care of that. First thing I've done is wash my hands and put on my gloves. And I have on my protective goggles and a face mask that will be on for all of our demonstrations. The first thing we'll do for his abrasion is put some light pressure on it if it's bleeding. They don't bleed too much. Mostly they get very gnarly with asphalt and gravel. And the more important thing for an abrasion is that it really needs to be scrubbed and cleaned. So the bleeding has stopped. You can clean with soap and water on every wound, or you can clean with an alcohol solution. I'm using my hand sanitizer. Squirt a bunch onto my gauze. An abrasion, you scrub and scrub and scrub, and it hurts. But you're scrubbing hard and you're getting out the grit and the dirt. If it's in a place like your face, your cheek, it will leave a scar if it's not cleaned. It's clean. Now I'm going to apply an antibiotic treatment. You can buy a triple ointment. It comes in small packs. I happen to have a tube of Neosporin. You can put the Neosporin directly on your gauze, or you can put it on the skin. If you put it on the skin, do not touch the tip to the skin because then you've contaminated your Neosporin. So the Neosporin is on my gauze. I'm going to cover his abrasion with this dressing. Can you hold it? Now, he's going to hopefully continue to bike, so we want him to have function of his knee and a dressing that stays on. You have several ways to secure that dressing over the abrasion. You can tape it. The tape will probably fall off with sweat. You can use an ACE wrap to wrap it. And in addition to that, if he has a sore knee, maybe he fell and chipped a bone in his patella, maybe he injured a ligament or a tendon, maybe he wants a little more support on that knee so he can continue biking. So to support the knee, I'll put an ACE wrap on, and it'll also cover his dressing. You start below the joint, go around a couple times to snug it down, then you move upward. A 6-inch size is best for this. Work your way back down. Hopefully he'll have range of motion in his knee. Can you hold that? And then again on the ACE wrap, you can use the clips that come with it, but you'll probably lose them. So the best thing is really to put a piece of tape on. So now, hopefully this will stay up. It's hard to keep that kind of dressing on when you're biking. You can add Coban to that and secure it a little more. This is a self-adhesive dressing. You have to be careful with it. If it's in your pack and it crunches down when it's stored, it will lose its function. And also, it can become tight if an extremity swells with an injury, so you have to check carefully for any complications from swelling. You do not want a tight bandage on there. But now, so he can try to bike with that. But if it hurts and he wants to hike out, and you suspect there may be an injury to maybe a little bone chip or a ligament or tendon problem, you can put a splint on. I carry a Splint. You can use your seated foam pad. You can use your Thermarest. With a Splint, bend it up a little bit, crimp it on the edges. This is Fold it in half for more support. When you crimp it up like that, it gives a little more support for bracing or immobilizing the joint. So we'll put that behind the joint so he can't bend his knee. And again, I'll take another ace wrap. Wrap that around, starting below the knee, working my way up. You can use an ace wrap, or you can also use triangular bandages or straps that you might have in your pack to secure a splint to immobilize. Now, if he can walk out, he's going to walk out. You're not going to wait for an evacuation for that.
Can't bend it.
He can't bend it. We'll tape that. And that is an abrasion. The next thing I'm going to talk about is punctures. Got your knife? Now, he's been out doing some tree work on a trail, and he punctured himself with a knife, or he's been whittling. He punctured himself with a knife. This has a 3-inch blade. You do not want to remove that because you don't know what the tip of that 3-inch blade is sitting against. It could be muscle, it could be artery, it could be vein, it could be a nerve, it could be bone. You do not want to take it out because you can make things worse. So the first thing we're going to do for this is control any bleeding that may be around it. You lightly press around it, and he's only holding that knife. It'll be stuck in there and be still. He's holding it for demo. But you gently press around it to control the bleeding. When the bleeding has stopped, you take a clean gauze, add your alcohol, and you scrub around it to keep it as clean as possible. And this one is gently because you don't want to wiggle that knife or whatever the imploding object is. You let that dry. Again, you take your Neosporin because you want to prevent infection. Puncture wounds are more likely to become infected than an abrasion. You either squirt the goop around it or you squirt it on your gauze. And then you wrap that around the object. To secure that, you take a triangular bandage. You can make a little donut hole. And to do that, you wrap it around your hand a few times. Then you start sliding the long end through the hole. Work around in a circle. Like that. And what you end up with is a nice donut. This slides over the object. It's a little big. There's some wiggle room. Crunch it down. Secure it. This just cushions it, keeps it immobile. Secure it with tape. As much as you want, between 2 and 4 pieces should do it nicely. My tape is pre-cut just for expediency. There's a 3rd piece going across. And here's a 4th piece, and now you can let go of it. So that's secure. To give it even more security, somebody will have to help position an arm or a leg if that's where the impaled object is. If the impaled object was in an abdomen, you're done. You monitor it. But for this one, you can add a little more security to that object to keep it still by wrapping it with an ace wrap. If there's any further bleeding on that dressing, you'll be able to see it. It'll come through the gauze. It'll soak up into the triangular bandage. It'll come onto the ace. So that's what you do with a puncture wound. If there's a puncture wound in the eye, a stick, whatever it could be. Now you see who Kurt is. We try to get good lighting. You would do the same thing. You'd never ever remove anything from an eye. Here's another donut. You would slide that very carefully over the impaled object. Somebody else will be helping you, not Kurt. Again, you can tape this to hold it in place. This is to immobilize the eye and prevent further damage. There are fluids in the eye that can leak out if this is not properly secured. What's going to happen? He's going to move his other eye. When he moves his right eye, his left eye is going to move. So you can put a patch over that or a tape. You hold that. And I'm going to put tape over that. This way, he's not looking around with his right eye, and his injured eye will be more stable. And now after that's put on, you can secure this with an ace wrap. Start on the unaffected side, just catch the top of that donut. Not tight, you don't want it to be too tight. At the bridge across his nose, you can turn it so you don't obstruct breathing. You'll be a little more comfortable. And you can wrap that carefully and gently around his eye. Hold this here and put another tape. And you can tape that. Now, this requires, both puncture wounds require evacuations. Puncture wounds are much more prone to infection. While you're waiting for evacuation, you would take the dressing down on a puncture or laceration every 4 hours to check for signs of increased infection or signs of infection, and you'd also would repeat the cleaning and clean dressing with clean antibiotic while you're waiting for evacuation. Okay, I'm just going to take this off because the last one, the last one will be a laceration. Oh, sorry, I forgot that one. Now we're going to do laceration of the arm. Thank you, Kurt. So Kurt has a laceration in his arm. Lacerations are deep, they get infected. It's important to clean it and then get a good dressing on it, and as I said, to monitor it. So with this laceration, the first thing you're going to do, again, is take a gauze and stop the bleeding. Bleeding will actually help clean the wound somewhat. So the bleeding is stopped. Now I'm going to irrigate it. There are several ways to irrigate it. All of them require clean, purified water. Don't use dirty water. If you have a squirt bottle, you can fill this and irrigate with water, if that's all you have. When you irrigate, you have your face protection on, your mask, your goggles for your eyes, and you irrigate away from your face and away from Kurt's face so that you don't get any splashes on your own skin. So you can use water. If you don't have a water bottle, you can use your Camelback. Take the mouth hose off because you've been drinking from it. Most of them have a locking mechanism. Hold up your Camelback and you can irrigate with your Camelback. That's the second way to do it. A third way, if you didn't have those, would be to use a plastic bag, fill it with water, clean water, cut a little hole in the corner, and you could use that to irrigate. But we carry a betadine or iodine solution from Walgreens. It's a small bottle, 1 fluid ounce. It's 2% solution. You don't have to remember what the solution is. All you need to know, if you carry this, so you put just a little bit in an Nalgene or your squirt bottle to make it tea-colored. When it's tea-colored, it is the proper dilution. If it's too strong, it will also ruin good tissue. So you want to make sure that it's tea-colored. After that, after you've mixed it in your Nalgene, we carry a syringe. You don't have to, you can squirt with your bottles. You would draw the solution up in your syringe, and it holds about 1 ounce. The good thing for using this is if you're on an extended trip, you can get a real good irrigation because it's under pressure now. So again, you irrigate away from your face with more pressure, higher flow, and it gets right into that laceration and cleans it out. Check it every 4 hours for infection. You're going to put
Check for wild animals.
You put Neosporin on the wound without contaminating the tip, or you put it on the dressing. Put that over the laceration. To secure this, you can use either tape or you can use an ACE wrap. Either one is fine. And you'll be able to see if it bleeds again. Irrigating might make it bleed again. You would just continue with pressure after that. So that's how you cure for a laceration on any part of the body. Now the last one is a scalp wound. Oh, yeah, he's got to get down on the ground just for better lighting. So he's fallen and hit his head on a rock, or more than likely, he's bumped his head on a tree or on a trunk. This happens a lot. First thing you're going to do is put, obviously, protective gear, and then put gauze on and hold it. Scalps bleed a lot. They bleed for a long time, so you're not just holding it, you're putting pressure on it to stop the bleeding. And you're going to check this after 10 minutes because it might bleed for a while. It's still bleeding. Put more pressure back on it. While you're holding it, you can do a neuro exam on Kurt or your victim. Ask them if they know where they are, what the date is, what happened. Do they have a headache? Are they nauseous? Are they getting a little foggy and lethargic, or are they remaining fully conscious? All those things you want to assess. You can easily do that while you're sitting here. And of course, you can reassure them. So if this continues to bleed, your next question would be, are you taking any blood thinners? Because this will bleed even a lot more if he's taking a blood thinner for a cardiac condition. So the bleeding is stopped. Now, I'll do the same thing. I will use my alcohol, scrub and clean around the wound. You don't want to do it right on top. The blood has kind of cleaned it. And you might make it bleed again. You could go gently over the top to really clean it if you see grit and dirt in there. After you clean it, you apply your antibiotic ointment to the wound or to the cloth. Put that on. Now you're going to put on a dressing, a bandage to hold the dressing in place. There are a couple ways to do that. Let me unwrap my other donut here. I'm going to use, for the first demonstration, a triangular bandage. You put the long tail in the back, put this over his head, bring it to the back, and give it a tie. Then pull on that, pull it down to make sure it's snug. And you can tie it up in front here. You'll be able to see if this continues to bleed or not. Another way to put a bandage on a skull is to use a balaclava. If you use a red one, you won't see it bleed. This one's yellow. So you put this on with help, like that. Take the long tail, try and coil it over the dressing, just a couple twists, and then fold this down. Give a solid skull dressing. You'll see if it bleeds, and it looks cool. And then, after you've done all your wound changes, you're going to have garbage. You get rid of it. Wrap this up in one glove. Grab the inside of this glove. I just grabbed the glove. I didn't touch my skin. Peel it off. Grab that in this hand. Grab this here. Peel it off. You have your garbage in your bag. Pop it in the bag where you stored your gloves. Seal it. Your contaminated waste is now contained. That's it.